Welcome everyone. Hello, good afternoon. Good to see all of you here. I'm Paul Irwin, Dean of the UAB School of Public Health. I'm excited to welcome you to our Fall 2024 Career Conversation with alumnus Dr. Scott Harris. I also want to acknowledge we have at least one other health officer in the room, Dr. Kevin Michaels, who is health officer for the Mobile County Health Department. And so we're pleased, Dr. Michaels, that you were able to join us. We also have other visitors from ADPH, the Alabama Department of Public Health. Very glad that you're here. Carolyn, good to see you. And I think we have some JCDH, Jefferson County Department of Health folks, yeah, and alum. So thank you for being here. So without further ado, I would like to introduce Dr. Scott Harris. Dr. Harris currently serves as the State Health Officer and Chief Executive Officer for the Alabama Department of Public Health, where he oversees over 2,500 employees statewide and a total budget in excess of $1 billion. Dr. Harris has clinical expertise in the management of infectious diseases, including sexually transmitted diseases, diseases of international travel, tuberculosis, HIV, and hepatitis C. Additionally, he has extensive experience in hospital leadership, which includes medical executive committee membership, medicine department chairmanship, and directorship of multiple committees, from infection control to pharmacy and therapeutics and surgical care improvement. Dr. Harris received his MPH with a concentration in health care organization and policy from the UAB School of Public Health in 2017. He completed his undergraduate in biochemistry from Harding University in 1987, and then went on to complete his MD here at UAB in 1991. After completing his MD, he then completed a residency in internal medicine with the former Caraway Methodist Medical Center in Birmingham, and then a fellowship in infectious diseases here at UAB. Last but not least, and I'll be asking him a little bit about this, he currently serves as a board member and as president-elect, and will be president in how many more? 2 more days.
2 weeks.
2 weeks, 2 weeks, of the Association of State and Territorial Health Officials, also goes by the acronym ASTHO. So Dr. Harris, thank you for being here, and welcome back to your place of graduation, if you will.
Thank you. Thank you very much. Good to be here.
Wonderful. So let's launch right into this, talking about career and career paths. You worked for a number of years in private practice before coming to the Alabama Department of Public Health, but tell us a bit about your path. How did you become the state health officer?
Wow. Thank you very much for that welcome and introduction, and thanks for having me. I'm honored to be here, and lunch brings in a lot of people, so that's great. So glad you can be here for this. I've been in this role currently, the current position now, a little over 7 years. I first got this role in 2017, but it was a circuitous route, you know, like you mentioned. I was an HIV doc for about 20 years, is how I would have described myself, I guess. I trained here, as you mentioned, and was in North Alabama, lived in the city of Decatur, and worked in that area among several hospitals, and had an outpatient practice that was primarily HIV. And that's what I really enjoy doing. But during that time, I began working a good bit with the health department on various things, you know, TB and STD and HIV patients I would see on their behalf if needed. And I don't know how many people can remember this, but after the events of 9/11 and the anthrax scare, there was a push to vaccinate first responders against smallpox.
Yes.
Does anybody remember that? Not many of us.
I got one.
Yeah, so did I. So in 2001, after not vaccinating anyone in this country for smallpox besides the military for a couple of decades, we began doing that again for about a week or two. But anyway, I was able to work with the health department and got to know them very well, and so had several sort of efforts maybe to recruit me to work for the health department. It didn't, but finally in 2015, I was offered a job as a health official, as a county, essentially district health officer in North Alabama. So that was really kind of the job I always wanted. And then when my predecessor retired, the state board of health people called and said, hey, we can't find anybody to do this job, and would you be interested in this? So that's how I got there. Really was not on my radar, but I know we'll get into this. But it really, my interest and what I wanted for myself and my career really changed as I came into public health. This program had the most to do with that, as we'll talk about. But.
Yeah, great. Thanks, Dr. Harris. So if there is any such thing as a typical day for you, what does it look like, and what are the roles and responsibilities of a state health officer?
Yeah, I wish it was more exciting.
You have less than 24 hours to answer that question.
Yeah, that's right. Yeah. So for one, every day is different. There is, really, there's a real boring aspect of it, which is a lot of it is operational, as you would understand in your role. But when you have a big organization, you can't help but be involved in the mechanics of the organization. And so there's plenty of working on budget and reviewing revenue and expenses, and there's plenty of personnel stuff and stuff that I don't enjoy necessarily, and certainly is not what inspired me to go into public health. But that's a big part of the job, because I serve as the chief executive of that organization. But the other big part of my work is really interacting with people outside the agency. I guess the best way to say it is who need to be interacted with. In many cases, they're entities that we regulate. So our agency, among many things we do, we regulate a lot of other industries, particularly in healthcare. And so we license and inspect and certify hospitals and nursing homes and dialysis centers. We also, as you know, inspect restaurants. We approve on-site, for septic systems, those sorts of things. And when people have problems in those areas, as often will happen, they need to speak to someone, and I'm the person that they often speak to. And that's just, that's how the job works. That's how any job works. I tell my folks quite often that I feel my job really is to protect the people at ADPH who actually do public health, so that they can keep doing their job. And really, I'm there to recruit resources to the department. I'm there to maintain stability. I'm there to keep bad press away if possible. And then we have a lot of good people that do a lot of good work.
Yeah. Yeah, we were fortunate to meet many of those people a week or so ago when Dr. McCormick and others organized a trip for students down to Prattville, and we were hosted by your department. It was a wonderful day for our students to get to meet various members of ADPH, so thank you again for that. Let's turn to something that you mentioned with your time in Decatur, working to establish the Decatur Morgan Community Free Clinic in 2004, and serving as the medical director there for 13 years. Can you tell us a little bit more about how that clinic functions and about your early involvement in getting it off the ground?
Sure. I was in Decatur practicing medicine maybe for 6 or 7 years. I was primarily seeing HIV patients, but a lot of other patients as well. I can't believe it took me so long to come to that realization about how many gaps we have in the healthcare system. But I finally, I've heard that before, but once you actually begin practicing medicine, you begin to see that. And, the concept of social determinants of health that we all understand and embrace was not a term, I don't think, in the 90s. It may have been, but we certainly realized what it was. It was very obvious that there are many populations that are just not served, that because they don't have access, because of other social determinants, because of many different reasons. And so it seemed like our community had a great number of people that just had nowhere to go for care. I'd say what made that effort successful is that we were able to make a case to hospitals in the community that, hey, your emergency departments are seeing patients that you're caring for anyway. These people don't have the ability to pay. They're frequently, as you would expect, showing up with more advanced, more expensive conditions that might have been prevented. And so we really worked with hospitals and with leaders, with the local officials, to emphasize how the clinic could serve everyone. It would be good for prevention. It would be, we made economic arguments for that, and that really won the day eventually, and we were able to obtain funding to do that. It wasn't only me. There were certainly other people involved in that as well. There were a core group of about half a dozen of us, a couple of other physicians. We had some opposition. There were, I can remember a physician arguing with me that I don't want to be involved with this. I do free care already, and I don't want to do any more free care. And so you have to be able to, hear where people are coming from, try to meet them in the middle and explain what your mission is. But ultimately, we found, a facility that we were able to renovate. We were able to recruit volunteers. We were able to get a pharmacy, an actual licensed pharmacy with a pharmacist, inspected by the State Board of Pharmacy. In our building, we used donated medications. It turned out to be a great project. It's still going strong. I'm going back next month for the 20th year anniversary. Wow. And I worked there. I don't want to be the one who takes credit for that. There have been hundreds of people who've made that successful. So.
Well, great. Well, congratulations on 20 years. That's spectacular. Trying to bridge those gaps in care, I'm sure, as the state health officer who ultimately ensures the health and well-being of everybody in the state, that trying to fill those gaps is a constant challenge. Yeah.
Absolutely.
The state health officer, in working as the state health officer, you serve obviously in a very highly visible, public-facing role. How do you handle these demands of being not only the messenger, but also the major advisor on critical health-related information for the state, when not everyone will support your recommendations? And let me give just a little bit of context for those of you who may not know. Alabama, I think, Dr. Harris, correct me if I'm wrong, is one of 4 states whose state health officer is not appointed by the governor, but in Alabama is appointed by the state board of the
State Committee of Public Health.
The State Committee of Public Health, which is a committee of the Medical Association of the state of Alabama. So you're not appointed by the governor. Ostensibly, then, the governor can't hire and fire you, although the governor controls your budget. Mm-hmm. So how do you navigate that? How do you become that messenger and simultaneously major advisor?
Not that well, a lot of people would say. That's a great question. So there has been change just this past legislative session. You and I talked about this recently in the governance of our department, but it is worth explaining that to folks who aren't aware of how that works. So in the 1870s, about 50 years after we became a state, our legislature wanted to develop a Department of Public Health and was really unable to fund it, and essentially contracted it out to a private association. They created in statute a state board of health that was comprised of physicians in the state who belonged to the medical association. That wasn't an unusual format at the time, and almost all of the country was that way, a century or so ago. Over time, that has changed for a lot of different reasons, primarily because chief executives in the state want to be in charge of the agencies in that state, right? And they create a cabinet, they choose who leads those departments, and that's very understandable. But a few states have maintained this old system. Even those states have mostly changed a little bit. South Carolina and Mississippi have systems similar to ours, although the governor has a lot of input in who's on the board, even if the governor's not directly choosing the health official. Oklahoma just changed in the past 6 or 7 years over, anyway, long story. But so in our state, I am in a way, sort of running a quasi-private public organization, which is a little bit strange. It's also not unprecedented in our state. There are certainly other professional boards, licensing boards, that have statutory authority to do things as well. So if you're an attorney, you have to join the Attorneys Association, the Bar Association, which is a trade association, but they also issue your license, and they allow you to practice law in the state. So there are other systems in which that works similarly. It's not a perfect comparison. But what's different about public health is that we're a really big statewide agency with a lot of people and a lot of authority. And so most of Alabamians probably didn't know that until COVID. And when that happened, people really wanted to know, why don't we have more accountability in firing that guy if we want to do that? Reasonable question to ask. So we have actually spent a lot of time over the past 3 or 4 years working with legislators, working with other stakeholders. You all may not know, Dr. Irwin did a masterful job running, herding cats for several months and bringing people together to sort of talk about public health governance and what it ought to look like and how things ought to be done. So I haven't thanked you enough for that, but you did a wonderful job of that. Anyway, this past legislative session, there were some very substantial changes made in how public health is governed here. The strict connection between the Medical Association and the Department of Public Health is gone. And so the actual so-called State Board of Health, which was comprised of the members of the association, was literally abolished, per se. So we have the State Committee of Public Health. A lot of those members are still appointed by the association, but it's not a majority anymore. We continue to have other types of professionals who serve on that board, and they sort of rotate among different groups, but we typically always have dentists, veterinarians, sanitation engineers, many times nurses or nutritionists, dietitians, other professionals, pharmacists. So we do have other folks that are represented there as well. The one difference is that the governor will appoint the next state health officer based on the recommendation from that committee. So you're stuck with me for right now. How the way to manage that, I don't know, Paul. I feel my way through that a lot, and I don't know how well I do that. But I would say any type of public-facing job or public official job or just a prominent job, it comes down to relationships and being able to build trust with people. And I think most of the leadership in our state, throughout all of our elected officials, they are reasonable people who are trying to do the right thing, and they want the same thing you do for our state. Different people have different values, and how do you get around to actually implementing things is the question. But being able to have good relationships with people so that they don't mistrust you just implicitly, so that they also know you have good motives, so that they know you're honest. That's probably the most important skill that I try to work on. Not that I always hit the mark there.
Well, in my experience, you hit the mark far more than you ever can imagine. And turnabout is fair play. This is really my first opportunity publicly to thank you, Dr. Scott Harris, for your incredible leadership through COVID-19. And all of our public health practice partners in the room. You're leading this state's effort in a very challenging environment with the governor leadership and others in the state pressing for different perspectives, different approaches, and you maintaining a very strong but pragmatic approach, using as much evidence as you were as you had at your disposal and that you were allowed to use thank you for leading us through that.
Well, thank you.
Yeah.
Thank you. Glad to still be
Thank
here.
you.
Thank you.
So, as we noted earlier, you are president-elect of ASTHO, the Association of State and Territorial Health Officials, a hugely important organization representing state and territorial public health agencies across the country. What are you learning in your role, and what are your priorities going from president-elect in 2 weeks now to president of ASTHO?
Yeah, that's a great question. I've got to, I'm speaking tomorrow to the whole organization, and I need to know the answer to that question before I speak to them. So ASTHO is a group that's been around for over 80 years. You know, there are similar type organizations among other types of state government departments, right? There, you know, we have the National Conference of State Legislators, we have the National Governors Association, there are other groups. This is the Association for State Public Health Departments, state and territorial public health departments. So there's 59 of us. There's the 50 states in DC, and then there's 5 U.S. territories and 3 freely associated states. So there's 59 of us. And it's, again, we made a reference earlier to herding cats. You know, it can be like that in a sense, because you have states and territories that are all working for different chief executives. They all have their own internal politics. They have their own internal interests. They have different levels of resources available to them. I mean, clearly there are states with a lot more resources to spend on public health than others. When you consider the territories and the freely associated states, you have other entities that don't even play by the same rules necessarily. You know, different legal systems, different authorities, and you know, you've heard it said many times, but you know, if you've seen one state health department, then you've only seen one state health department, right? We're all different in a lot of different ways. So, coming into this, there's an opportunity, I think, to try to strengthen our relationships with each other. We do a lot of things that are about engagement, just so that we have face-to-face connection and that we have the ability to communicate openly. There are a lot of, you know, of public officials in other areas in our country who can't be photographed with their counterpart in another state, depending on the politics, right? And in public health, we don't ever want to be in that situation. We sometimes are the ones that can have really open and frank conversations when maybe other officials in a given state can't do that. So it's very important to me that we maintain cohesion, that we all remember why we are there. There's a lot of aspects of ASTHO that are sort of capacity building and technical assistance that apply to everyone, no matter what your politics are. And that's something that we want to work very hard to emphasize. But it's a difficult political time. There's some ways public health, you know, is a really polarizing issue, right? You know, after COVID, there are, you know, a lot of people with a lot of, you know, legitimate complaints about things that happened. And so we want to make sure, first of all, that we're still here to do our job, that we don't lose the ability to do our job. And I think that starts with the relationships among us in ASTHO. The other aspect of ASTHO, an even bigger part that most people don't know that much about, is they're sort of their own health department or their own school of public health, in that they receive a lot of federal funding to support the activities that they do for states. They manage a lot of grants. They have a lot of staff spread all over the country. So it is the club for health officers in a sense, but it's a much bigger organization and there's a need for us to work on financial sustainability for that organization and other things the same way you would do in your own programs.
Yeah.
Was that the question? I think.
I think you'll do well on the call tomorrow.
Yeah, well, we'll see what happens.
Okay. So a common assumption with those unfamiliar with what public health fully entails, and I don't think that's anyone in this room, but is that it has something to do with the health department. Shazam.
Yeah, right.
Well, while that's technically true, especially in your case, what more do you wish people understood about working in public health and or about working for ADPH in general?
Well, that's a great question. I would say that, the most common thing you hear from people who don't know about us is sort of what you said. They somehow envision that if you're poor, you go to the health department to get care, and they don't really know much else about that, but they're pretty sure that's what you do.
Yeah.
And so that's a really common, not complete misconception, but really incomplete view of things. Again, I don't think I have to tell the people in this room, but what I like about public health is I really love public health. The message that we try to get out to people, if we really distill it down to a single little aphorism, we just want people to get a fair shake in life. That's what we want. People shouldn't see the trajectory of their health and wellness determined by their zip code or their race or how much money they make or how far their parents went in school. I mean, those shouldn't really matter, but we all know they matter tremendously. They do matter tremendously. Again, health equity is something that we understand kind of just innately, and we said that even before we talked about health equity as a term. Right. I'll say that recently I was reviewing this giant collection of old documents that someone left in my office from decades ago, apparently, and I found our annual health report from before World War I can't remember, 1911 or 1912, or something like that, and there was a really big section on health equity. Wow. So 110 years ago, yeah. and it's because you can't be in this business without recognizing the facts on the ground, right? Yeah. Right. So I think when someone asks me what I do, I say, we just think everybody ought to get a fair shake. That's what we think. We think there ought to be a level playing field. And then you use that to explain what you actually do. The second note, less interesting than that is, when you begin to list all the things that public health actually does, most people have no idea. So we do inspect restaurants and do perk tests for septic tanks. We also do emergency response for our nuclear power plants. We're also involved with inspecting nursing homes and hospitals, as I mentioned. Anyway, the list goes on and on and on. We run the Children's Health Insurance Program for insurance for low-income children. There's so many things that just statutorily, for some reason, got punted into public health over the years that I still feel like I'm finding out things, every time we have a Board of Health meeting that I didn't know we did. I'm barely joking about that.
I can well understand. My goodness, with 2,500 employees and an organization as large as yours, not knowing what you don't know is sort of discombobulating.
Sometimes they don't want to tell me. They don't want me to know that.
Well, let's turn a little bit to talk about your time as a student in public health. You chose to complete your MPH several years after being in the workforce, after you completed your MD and working in the medical field. What led you to want to pursue an MPH, and how did you choose your concentration area?
Yeah, that's a great question. So as I mentioned earlier, I was a private practice physician for many years, and I guess I thought I knew what I was doing. I did that very well, I guess. Really enjoyed that work a lot. But as I made a transition into public health, when I got my first job in public health, I realized I didn't know anything. I mean, there was so much of the world I was really unaware of. I felt like an expert on the practice of clinical medicine, whether I was or not. But population health was a concept I didn't understand very well, and it took me a while to make that transition. So I knew that I just needed to learn more, and so I actually participated in the online program. I was a little skeptical, this was 7 or 8 years ago. Is this really a rigorous program? I can go online and, be a nuclear physicist next week if I want. Those programs are out there. So I wasn't really sure, but a couple of people who had done it had recommended it to me. And I've told you this before, Paul, it's no secret. This really changed my life. I mean, I learned more about myself and my state and about how to care for people in this program than I had done in the previous 20 years.
Wow.
And it's because the picture is so much bigger than, given the right medicine for the illness that you diagnose. I mean, that's a big part of it,
Yeah.
but it's so much more than that. And I don't know, I guess I lived in a bubble for a long time and failed to recognize that. So the program for me was incredibly important. I vaguely felt like policy was the area that I would gravitate to in some way. I certainly enjoy epi a lot. I'm not bright enough to do biostats. Environmental work is really interesting to me, but healthcare policy is the one that just attracted me the most because of its subject matter, and that's where I ended up. And it was terrific.
Great. Thanks for that. What advice do you have for current students in terms of life after they complete their degrees, or for those who may feel somewhat unsure of their future goals?
Oh, that's easy. What an easy
Come
question.
work for you.
Yeah, that's right. Yeah, I was going to give you a commercial here. There's a lot of sort of practical things I can tell you, and then there's a lot of sort of big warm and fuzzy things that you could add there, I guess. I will say, the program itself gave me not just knowledge I didn't have and understanding I didn't have, but it gave me really practical skills I didn't have. Dr. Ginner's textbook on management, I mean, I use that every day. I mean, I took a health economics class that was tremendously helpful. Depending on what you want to do in your career, if you're going to go work in a big healthcare organization, if you're going to even work for a nonprofit, if you want to come work for public health, the longer you stay, there's an increasing likelihood that you're going to manage other people, which means you're going to manage budgets and you're going to manage personnel. And those are tools that you ought to start working on as early as you can. I didn't like that stuff. That wasn't, I went from managing 2 people, who worked for me only, to managing 2,500 people, and it happened in a couple of days, it felt like. And so eventually, most people won't have that abrupt transition, but I would say there are probably real, concrete skills that you can probably think of in yourself that you don't have that you need. Make sure you can use Excel, and make sure you can read a balance sheet, and make sure you can learn how to make a budget. Those things will help you a lot. The big picture thing, though, in this is, it sounds like such a corny thing to say, but just figure out what you love doing and try to figure out how to make that work. I mean, that's really the answer. It's so, it's not unique to public health or anywhere, but education versus career now, it's become so transactional, where it's like a return on investment calculation. Well, if I spend this much money on this degree, I can get this job and get this income, and I can pay my loans off in this amount of time. And that's real, and I totally get that. But don't forget to put in there, you want to do something you actually like doing.
Yeah.
If you can do that. So find what you like. If you don't know yet, that's okay. Look how long it took me to get where I am. But I mentioned to someone earlier, when I got into this program, when I got into the MPH program, I finally thought, oh, I've finally met my people. Like I've been looking for these people. I knew what my values were. I knew where my interests were, but I didn't know where all the people were like me, and then I found them when I got here. Mm-hmm. And so I would say try to find your people, wherever that leads you.
Oh, what a great statement of values to go on. Find your people. So, Dr. Harris, I can't thank you enough.
Oh, thank you
for being here, for sharing your perspectives, for your wisdom. Again, I want to thank you on behalf of everyone in the school for leading us at the Alabama Department of Public Health, and look forward to many times for your coming back here and being with us. So
Thank
final
you.
word to you.
Oh, thank you. It's an honor to be here. Thank you. Public health is the best job you can ever have, so you're in the right place.
Good, thank you.